So here we go with sitting, because people with back pain often find sitting almost impossible. They can do everything else, but they can't sit. So bear in mind that the spine to sit comfortably should be in balance. Now you can see the spine in standing on the left hand side here has this wonderful elongated S-bend, a lumbar lordosis here, a hollow, a thoracic kyphosis, and the cervical lordosis with the very heavy head sitting on top. That's a beautiful elongated spring mechanism, so that when you walk along the pavement that sinks and springs. Ideally, you try and keep as close to you possibly can with sitting to keeping this lovely S-bend. Now what tends to happen with sitting, especially if you're sitting for long periods of time, is that you lose your S-bend and you get the C-bend, with hours literally spent crumpled with your head forward, especially if there's a thing called a computer sitting out the front here. So we go into a C-bend, and you can see here from these little graphics, these are the intradiscal pressures inside the disc, greatest with bending forward, lifting up a weight. But here we have the sitting postures. Upright sitting, slumped sitting is very high, but I don't know whether you can see here, there's a tiny little graphic here, there's a tiny little back support where that person is sitting laid back, which gives some clue to the getting comfortable in sitting. The more you can relax back, in fact, the more you can keep this part of your spine slightly arched, then the more comfortable you're going to be. Now that's not easy long term. This is what happens if you sit slumped for long periods of time, that all this huge body weight of your upper torso carried forward tends to flatten your lumbar disc. Over time it loses height, and then you start getting problems with the facet joints as well, because you don't have enough separation here. But what happens short term in a diurnal way is that the more you sit slumped forward, the more you squeeze fluid out of the discs, which is where the back block comes in, of course, where you need to be opening back the other way here, literally using the back block as what I call the anti-sitting device, so that you can undo some of the ill effects of sitting. Now the important thing about sitting is to try and use a pillow. While you're in pain, you cannot afford to be using a kneeling chair or a saddle chair, and you also must not try and sit bolt upright without support, such as sitting on a football. When you're rehabilitating and trying to get yourself out of pain, you need a pillow behind your back, and a big pillow wedged between your lumbar hollow here and the back of the chair. A bed pillow is the best thing, although if it's lost its stuffing it won't be good enough. And it literally leaves you there so you can sit back and relax. Your belly's off duty. Sometimes you feel as if you're too gutty. You just have to ignore that. You need a pillow. Now I'll go through in the next little video clip the best and the worst of chairs. But even with the best of chairs, if your back is bad, you often do need that pillow. Just get used to it. The little lumbar supports aren't usually good enough because they're not bulky enough. They don't give you enough support. I describe that as not giving enough support to the tired spine. When the spine is tired, it slumps more and more into the C-bend, and that's why you need that very bulky pillow. Okay, so now we'll go into what makes the best chair.